Hey everyone, I'm here with George Wentz. He's a CPO or certified prosthetist out in Harlingen. Thank you so much for joining us today, Mr. Wentz.
Thank you.
Tell me a little bit about your line of work and what do you do? What does a prosthetist do?
A prosthetist makes artificial limbs, typically arms and legs, for patients that have lost their limb.
And you have a whole business of this, right? A whole
Yes.
factory or laboratory, would you call it?
We have a lab in the back. We have a clinic, and we see patients who have lost their limbs, and we also see patients who have a limb that's not functioning correctly, and that's orthotics.
Okay. Tell me a little bit about, we're here mainly because of diabetes.
Yes.
In your line of work, how many patients are diabetic?
Prosthetics, you're probably talking about 80% or higher are diabetic related amputations. We also see patients for shoes and preventative type measures, and that's another large number.
And tell me what goes into making these prosthetics for some of these patients?
Well, typically we evaluate them. We take a cast. We make a model that we let them try and make sure everything fits correctly and works good for them. And then from there, we make a final leg that they can take with them and walk on and use every day, just like everybody else.
And tell me the age groups of the people going into your business.
I see patients that are infants all the way to geriatric population. Your diabetic population tends to be a little bit older, middle-aged, or older, mostly, is what I'm seeing.
No children in that for diabetes?
Not typically amputees that are related to diabetes.
Okay, but a lot of patients are.
Oh yes.
That.
Yes.
When they come in, what do you see? Do you see them before their leg is amputated or after?
We see them the whole way through. We see people very often to get diabetic shoes and inserts, and the whole purpose there is to be preventative. And it's a lot about diabetic education to make sure that they are aware of the dangers and why it's necessary to wear the shoes that are a little bit different and the inserts to protect their feet. And then from there it goes all the way to afterwards when potentially they have become an amputee.
Yeah, and it's sort of like you have to change your lifestyle in that sense when you become a diabetic. Tell me about those dangers you were discussing, you mentioned a little bit ago. What are some of those dangers that they should be aware of?
Well, diabetes it's really kind of a sneaky disease. And so it affects your circulation and it affects your ability to perceive pain, pressure. So you're not able to tell when you need to be protective. So something may not feel hot to you. Something that's sharp enough to cause pain to somebody else you may not feel as a diabetic. So it becomes a lifestyle of making sure that you check those things yourself if you can visually, or have somebody else check that for you, because you're being hit with a double problem. You can't feel when something's hurt possibly, and then your circulation's not great, so you don't heal well. So if something happens, it can go from nothing to a real problem really quick.
Wow. And tell me, why do diabetes affect these limbs?
Because like I'm saying, since it's affecting the circulation, and then since it's affecting your sensation, it tends to affect the extremities first, and your toes are the furthest away from you. So that's the area that you're most likely to see the problems. And it starts with maybe a little bit of numbness in your toes, or patients will say that now their feet feel like sandbags. They don't feel like feet anymore, they're just under them.
What are some steps for families to take when they're in this process, meeting you for the first time?
I usually, the first thing I do is find out how much have they been told or talk to doctors and other professionals. And then I start going through what I say are the biggest concerns. And for somebody that's a diabetic that has no issues otherwise, I say that you need to be careful whenever you're barefoot, whenever you're in slippers, sandals, or socks, because those are all the ways that you can accidentally cause a little wound to yourself. A shoe really does protect you. So if you accidentally step on something sharp, a rock, if you accidentally kick the corner of a piece of furniture, that can cause a little wound that can go become infected and then cause a real problem. So I want to say, get in the habit of checking every day. Visually inspect your feet or have somebody else do it.
And what are some of the common questions you get from these diabetes patients that come in there?
Well, I mean, especially if they're a new amputee, we're talking about is their lifestyle going to change? Can they get back to doing what they used to do? How heavy is a prosthesis? How does it work? And for the most part, people, as long as they are healthy otherwise, they should be able to get back right back to the level they were at. The prosthesis should be able to keep them as active as they were before.
What do they tell you the feeling and what it feels like? Is it
wearing a prosthesis?
Yeah.
A prosthesis, I mean, different ones tell me different things, but if a prosthesis is fitting well and working well, it almost becomes like their leg and they don't notice it or think about it. When a prosthesis is not fitting well, then it's a constant problem.
How big of an industry is it out here, these prosthetic companies like yourself?
I mean, there are, it changes down here. There are a few down here right now. Diabetes is fairly prevalent down here in the valley, so I mean, Is it hard to know that obviously you're a business, right?
But also there's a diabetes problem, so they're coming to
Right.
talk to you about diabetes and they have issues because of diabetes. What can you say to patients or people watching that this is also a business, but you also want to inform people and educate them at the same time. You don't want there to make money, right?
Well, right. I mean, I think of it as any other health profession. It's just like physical therapy or a doctor or a dentist. You have an issue and we're trying to help you with it. The benefit for us is that most always we're helping somebody do better. A lot of healthcare, there are issues where things maybe stay the same or don't get better so much. But we're in a great profession in that we're helping somebody who's coming in and maybe can't walk, and we get to help them walk. So that's a great thing.
That's great. Well, how long does the process take? Let's say, someone comes in for the first time. How long does it take for them to walk out the door with a new leg or arm or?
Truthfully, right now, paperwork and insurance is often the leading factor in time. There are a lot of hoops to jump through, make sure that we're following all the rules. But if it's not unheard of for somebody, they come in, I see them, a week later, week and a half later, I do a test socket, and a week to a week and a half later, they have a leg. So somebody can go from not being able to walk or having not walked for a year to 2 to 3 weeks later walking again.
Do you guys do rehab with them?
We don't do rehab.
Okay.
I do like for my patients to at least be able to stand and walk, whether it's with a walker or cane or nothing, before they leave, so that when they get to therapy, I know that they're at least at a minimum standard for them.
Okay. How long have you been doing this?
I've been doing this for about 23 years.
23 years.
Yeah.
What does it take to get in your position?
It's changed a little bit since when I started. Now you, at minimum, must have a master's in prosthetics and orthotics in addition to any other education you might have. After you've fulfilled the educational requirements, you have to get, typically you spend a year in either discipline, orthotics or prosthetics, and at the end of that year, you're eligible to take an exam to become certified.
Tell me a little bit about the families with their loved one that's going through this diabetic change. What exactly are questions they ask? What do you tell them?
Well, I mean, I try and tell them some of the same things. Sometimes it's really important to get the spouse or the loved ones on board to help, because they may not understand some of the process that the patient's going through. It's not uncommon for a diabetic patient to have visual issues. Therefore, sometimes the spouse is the one that has to do the visual checks for the patient. And then just letting them understand the whole process so that they all know how they're going to move forward and they feel comfortable with it and can help each other.
Are losing limbs like this preventable?
It's yes and no. I mean, there are issues always. People can reach a point where their leg is just not salvageable due to outside influence. It may not just be straight up the diabetes that caused it. Obviously, it's best to keep your blood sugar in line, to see your doctor regularly, maybe see your podiatrist to make sure that your nails are getting trimmed, and become aware educationally, whether through some other medical professional or myself, as to what they need to do to prevent the problems.
Okay. What is the youngest patient you've helped with diabetes?
With diabetes, I've worked with a young, probably, I think he was about 18 years old, which is relatively young for a diabetic patient that's had an amputation that was above the knee amputee.
Can you explain the difference between above the knee and below the knee, and the differences, how hard that could be?
There's an incredible difference as you go above the joints. So a below the knee amputation is difficult. An above the knee amputation is significantly harder, because you're using your hip effectively to cause the whole leg to function. So the muscles of the hip really weren't designed to be controlling your knee motion. So you're using muscles differently than a normal person would to do the same thing. So it's a lot harder when you get above the knee. It's even harder if it's even higher, if you have like a hemipelvectomy, because then you don't have even a hip, so you're having to use your torso to get the leg to extend. So the higher up you go, the harder it is.
Even in those rough situations, have you seen people changed because of their prosthetic?
Yes. I mean, it always, I never say that somebody can't do something. We always go in knowing that the patient may be able to do anything. It doesn't matter how old they are. It doesn't matter how long it's been since they've walked. It doesn't matter how high the amputation level is. I have patients that are very high-level amputees that walk around every day, and most people probably would never guess. I have people that are amputated on both legs, and I doubt people know that all of them are amputees even.
Wow. So it gives them that confidence.
Yeah, and it lets them live their life, and I think that's what most of them want, is just to get back to living their life as much as possible the way it was before.
And as far as after you get the foot, are there checkups with you?
Yes.
How are they regular checkups or?
I mean, it varies by the patient. Some patients develop and walk faster and go faster than other patients. But I usually see somebody a week to a week and a half, and then it's maybe another week to a week and a half, maybe 3 months, then 6 months, and then pretty regularly we should see people 6 months to a year just to make sure everything's going well.
Okay, so before all that happens, before you get a limb, let's go into the shoes a little bit more.
Yes.
And the inserts or the insoles. How are those designed?
Basically, the shoes typically are what are called an extra depth shoe. And the whole purpose of an extra depth shoe is that you have room to put an insert in there and not shove the toes to the top of the shoe. Because you don't want pressure on the tops, you don't want pressure on the ends, you don't want a tight shoe, you want a little bit of room in it. And then the insert is designed to mold to the foot. So if there's too much pressure somewhere, the foam will mold away to leave a valley to protect that area. And then they have a soft area to always remain cushiony.
Okay. How do those help?
Well, what it does is it spreads out the force so that you don't get too much force in one area, so you're less likely to get an ulcer or well, typically people will get a callus if they're getting too much pressure somewhere. So we don't want to get calluses, we don't want to get pressure sores, we don't want to get anything like that. We just want to protect the skin and make sure that the foot stays healthy.
And there's many different types of shoes, right?
They have gotten better.
Okay.
Some of them are quite attractive. They're not all the old style boxy shoe that they used to be. You can get tennis shoes now. You can get Velcro lace. I don't ever recommend an open-toed shoe for a diabetic just because that's potential damage to the foot if something falls on it or they accidentally kick something.
I heard too one time that with the diabetic patient, their foot sizes change. Is that true? Or?
It can be. I mean, I don't necessarily say it's 100% related to diabetes. It could be related just to the foot itself losing some of its structural integrity.
Okay.
But a diabetic's foot can be susceptible to more disfigurement. The numbness can let you walk on your foot incorrectly and it doesn't hurt. And so your foot can kind of break down more, and as it breaks down it can get wider, it can get longer.
How much do some of these shoes cost?
I mean, it's all based on an insurance price.
Okay.
But it's not as high as you might think when you think about what a typical athletic shoe, or if somebody goes to like San Antonio Shoe Company has a typical shoe that people buy, and those run like over $100. I think typical diabetic shoe cost is somewhere between $90 and $100.
Yeah, that's not that bad compared to the shoes they have out now.
Yeah,
like 130, 145. What about for a prosthetic?
A prosthesis can vary. What you would consider an old school prosthesis that suspends with just a strap and has the simplest foot out there probably still runs about $3,000 to $4,000.
Wow.
An expensive prosthesis using a microprocessor foot or a microprocessor knee, you're getting into the tens of thousands of dollars.
Why do they cost so much?
Mostly, it's kind of like with a drug company. They've developed their product and they have their drug. With us, somebody has made this foot. In the case of a microprocessor foot, it's a computer-controlled foot. And they have invested so much time and money in the research of it, and then it's actually a computer, so it does have some electronic components to it.
Wow. I guess the ratio of male and female patients, what do you have more of?
Typically, you have more male amputees than you do female amputees.
Okay.
I can't
on
tell
any
you for sure.
on any given day, or year, or sometime when you're with that patient,
Mm-hmm.
do you typically see them again for another leg or an arm or something like that? Is that
Typically,
common?
no. I mean, you want a leg to last as long as it can. The problem is, the reality is, if you think about it, every time somebody takes a step, that leg is taking all of the person's weight. So we have to spread all that weight over a very small surface, which is the limb. That causes the limb to shrink. So over time, with muscle atrophy and the constant pressure, it can shrink.
Okay. What's some advice you can give to those that are watching right now? What can you tell them about going through this process?
I think keep yourself informed in education. Ask as many questions of all of the health professionals you're going with. Feel comfortable with the people you're working with, and then make sure that you're if you're having any issues or any problems, let somebody know. Never wait with diabetes. I mean, if you stub your toe, don't wait until it's a real problem. Go see your doctor or go to the emergency room if it's looking like it's a real wound.
There are some comments on Facebook, some questions saying, is it true that you don't use it till you lose it? I'm not sure what they're trying to mean by that, but
well,
I'm sure
now like something, well, yeah. You may not know, you may miss it as soon as you lose it. I do tell people that in illness, it's very common, if you don't use it, you will lose it. If you are sitting and inactive and you're not using the muscles and you're not getting your legs straight, when you want to straighten your leg out and when you want to stand back up and walk, you're going to be weaker. And it takes time to gain that back. So you definitely don't want to stop doing everything. Keep being as active as you can. Even if you're in a wheelchair, keep being as mobile as you can.
Is there a stigma in the Valley with diabetes?
I don't know that. I don't think of it as a stigma, really. I mean, there's
Is there enough education? Because it's really prevalent here.
It is very prevalent. I think it's hard to understand the problems that a diabetic has unless you have maybe a relative that's in it, and people for the most part like to wait until something is a problem. So if it's not bothering them until it does, they don't really pay attention to it.
Have you experienced any type of diabetes in your family, or?
Not in my immediate family. Some of my other relatives have had diabetes. One of my uncles had diabetes.
What have you learned working with a lot of diabetes patients and working with ways that what they go through? What have you learned?
I mean, for me, it's a very difficult disease to deal with because it isn't as fast. It's slow. It creeps up on you. So I guess I've learned that if they're not well educated, the problems can become big really quick. So trying to make sure people understand how it works and how diabetes can affect you is really important.
Are there ways to prevent someone with diabetes for coming to see you?
Yes, and for the most part, it's like I was saying, where you want to stay up with your doctor. You want to follow all the diet restrictions if there are any. You want to take your medicines. I know it's difficult when you've gone through your whole life being able to eat whatever you want or drink whatever you want, and somebody's telling you now you can't drink Coke all the time. That's a hard thing. Or you can't go to Whataburger. You've been going there all your life and you want to be able to just eat whatever whenever you want. Just follow the restrictions that you have, keep up your exercise, see your medical professionals, and keep everything in control.
Wow. Tell me a little bit. Let's go back to the process of getting a prosthetic. Someone comes in. What's the first thing you tell them?
The first thing usually I don't tell them. First thing I start doing is asking.
You ask, okay.
Because I think the most important thing is to find out what their expectations are, and then be honest with them. If their expectation is something that they couldn't easily do before, then I'm not going to be able to do something that can make you do something you couldn't easily do just before your amputation. But as long as everybody is on the same page, we're going to do great. You're going to get right back where you were, and I'm going to get you back on the road.
Okay. We got another question here. It says, I'm just going to read off from what they said. I've had type 2 diabetes for 10 years. I have an ulcer on the bottom of my foot for 6 months, but for the last 2 months it is still there. I have a doctor looking at it. No change at all. Can you help me? This might go into that shoe issue, though, right? Can you help someone that has a wound on their foot with the shoe, or?
There are various treatments. I mean, walking on an ulcer obviously can make it worse. So trying to keep pressure off that is really important. If you do have to walk, definitely something like a diabetic shoe and insert's a lot safer than trying to walk with nothing. Definitely keep up with your wound care physician. There are various treatments they use that can really help heal up a wound. And listen to them on activity, but circulation is important to healing. Mm-hmm. So anything that they'll allow, whether it's exercising with your foot off the ground, great. Anything that increases it and gets things healing better, great.
And for those who are, I guess, going to get a prosthetic, or is there any other assistance for them? I know you said it deals a lot with Medicare and Medicaid. Is there any assistance, like programs out there for those who can't afford it?
There is. It used to be called the Department of Rehabilitation. I believe now it's called VAIL. That's something we refer to people to. There are various organizations that help people to pay for them. We work with people all the time to try and help them regardless of the insurance they have, to get them back up and get going and get walking.
How many patients right now do you have that are diabetes, that come to you because of diabetes?
It would be a total guess, but I mean, I've probably got thousands of patients that are, because when you talk about amputees and diabetic shoes, now some of them I'm not seeing constantly. Somebody I may not see except once a year for diabetic shoes, but there are a lot of them.
Are they just here in the valley, or is it just here?
No. Are you saying my patients?
Yeah, your patients, so thousands in the valley, right?
Yeah. Yeah, well, but not all amputees.
Okay.
Most of those are probably going to be diabetic shoes. And diabetic shoe patients don't all come to see us. There are many providers of diabetic shoes down here in the valley.
I think this question says, if you get a prosthetic, does your diabetes go away?
No. Now, can it get better? Yes.
Okay,
because
that's good. It can get better.
It can get better, because if you're able to walk and move around and exercise and do healthy things, that's going to help you control your blood sugar.
That's really most important thing that people need to do, is check that BAC, right? Or
they need to
blood sugar levels.
Yes, and just make sure that everything's going well, that the medication's working, and that because like I was saying, since it's so sneaky and it kind of goes so slow, if you can just keep trying to keep it at bay, that's the best thing that you can do, and lead your life and not let it just overpower you.
Oh, again, can you name some advice, give some advice for the families that are going through this scenario with their loved one?
Well, to me, I would say that bear with them, help them, and know that there is light at the end of the tunnel. They're going to be back. They don't, just because somebody is becoming an amputee, it's not the end of the road. It's not as big a deal as some people might think.
Is there any counseling for that too? Do you guys provide like?
We don't I don't directly provide counseling, but we have people that work with Hanger that we like to have patient advocates who are patients who are amputees and have been through the process and can talk to a patient and tell them directly from their viewpoint.
Okay, that's great. What do they say? What
well, I mean,
like,
obviously it depends on the type, but most of them are, what they want them to see is, look what I can do. So you can be here too. You can be as active as I am.
it's like a great message for everyone out there that's watching this right now. What's some more advice you can give to those going through the process, not the family members, but to those for the first time entering your office?
I mean, I think that trying to keep a real good attitude about it and being positive about the process and the experience will really help you. There are issues. I'm not going to pretend that, you know, wearing a prosthesis is simple and easy, but you can overcome those, and so don't dwell on the bad, just look forward to the good.
Okay. Is there different foot care concerns or problems dealing with type 1 and type 2 diabetes? Are there two different problems with those?
For me, that's more how the doctor treats them. For me, if they're coming to me for diabetic shoes, they have to have certain issues. They have to have either neuropathy, which is going to be the numbness or the issues with sensation, and they have to have calluses that have been building up. They have to have possibly had ulcers in the past. Poor circulation that is potentially a precursor to all this. So, and whether they're type 1 or they're type 2, as long as they have those precursors, I'm probably going to treat them about the same.
Okay, so it really doesn't matter if they're type 1, type 2, if they just have those same
right, because
issues.
when by the time they're coming to me, they'll be having some sort of an issue that a doctor has seen. So once they're having that issue, then I'm going to treat them based on the issue, not so much on what type of diabetes they have.
Okay, so you're saying you have more than 1,000 patients that have come with you with issues because of diabetes.
Yes.
Do you have people coming from outside the valley seeing you as well?
Yeah, I mean, we get people that come from Mexico sometimes, and then we have people that come from Corpus sometimes, from areas that are outskirts to the valley. So, and then we have a lot of winter Texans that come down here. So we have people from all over the United States that see us periodically in those winter months.
Okay, in the background here, okay, you see this finished model of your foot or a prosthetic. Are those cuts unique or personal to that person? Are they fitted for that person that's getting that prosthetic?
Each one is made really only for one person. It's not designed to work for anybody else. The socket is made specifically for that person. The foot per se could be used by somebody else, but the socket is unique to each person. Everybody's different. The pressure needs to be distributed different, and so each one's made different.
You guys test them out,
yes,
beforehand, just to see if that person likes it, if it's cutting them, or.
Oh yes, yeah. we that's the test socket phase, and so usually we start making sure that things are feeling good at that phase. And then when we deliver the prosthesis, we try and make sure that it feels perfect then, as good as we can do it. But it's routine to have them come back in a week, because when you haven't walked in a while and when you're learning to walk on something different, we have to make adjustments to the prosthesis, to the alignment, to the socket, to make sure that it's doing everything. And the way you walk when you first get it may be different than the way you're going to be walking in a week or 2 weeks. The way you walk with a cane is totally different than the way you walk with a walker. So we have to align the prosthesis for you at each stage.
What's the material that you use?
We use a lot of different materials.
Okay.
The lightweight materials we use are titanium, we use carbon, we use Kevlar, we use basalt. Those all, the titanium's usually used in the metal type components. We use aluminum. We try and use things that are lightweight but strong, so that the leg doesn't feel too heavy. The leg does not weigh as much typically as the leg used to weigh, but it's held on differently, so the weight doesn't always feel the same anymore, no matter what we do.
And the material that's on the socket itself,
Mm-hmm.
You have to be worried about cutting the person, right, for wounds. What material is used there? Is it like a clear or a smooth?
The socket itself, it's usually we like to use a hard socket with a flexible inner, and then on the patient there are various liners that they can weld. That's like a gel sock that they wear, and that protects the skin. In the old days, you just had socks,
okay,
and they would just put on a number of socks, 5, 6, 7, and that would fill up the space and make it soft enough. But with the urethane and some of the other gels we use, we can protect the skin pretty good.
Yeah, okay. So when you have that socket there, how long is it going to last? How long does the prosthetic last?
It's first, it is a mechanical device, so it's possible that there could be some failure at some point. We typically would like components to last at least 5 years to 7 years, but if a person changes, if their limb changes size or shape enough that we can't adjust the socket and have them safely walk, then they need a new socket. If their foot starts delaminating for whatever reason, maybe how much they use it or the activities they do, well, then we'd have to get them another foot.
How often do you see a person for the second time that came in with a missing limb, and then due to diabetes they came again for another missing limb?
More often than I'd like, but it's still rarer. I mean, one of the first things I tell people after we've discussed everything is that your other foot, treat it like gold. You don't want to have another amputation, so really, really, really protect that other foot.
And usually we've been talking about a lot of foot prosthetics. Is there any issues with arms at all, or diabetes?
Not as often with diabetes.
Okay.
You do get some, but it's usually, by the time it's affecting fingers and hands, it's far enough along that there are a lot of health complications.
Oh, with the disease, right?
Right.
Wow, I didn't even think of that. When it goes up to your hands.
Yeah,
like
the circulation in your hands is better than the circulation in your feet. So typically we don't see a lot of amputations directly resulting from diabetes in the hands.
Okay, what are some exercises that people can do with a prosthetic? Just, let's say you want to change your lifestyle, you want to eat healthy, work out. Is there a different type of prosthetic for that, or is it just different exercises?
One of the things that's really key is finding out a patient's activity level. When we talk with them, we want to know what are their expectations and what do they want to do. If they were somebody that could before or has reached a point where they think they can now, wants to walk long distances fast up and down hills, great. If they say that they want to get to jogging, fine. If they want to ride a bicycle, fine. If they want to play basketball again, and they did before, no problem. We can do all that. We can pick a foot that helps. A foot that's really good for just sprinting or running is not great for walking. So that if you're going to be doing, if you're using it just for sprinting type things, then that would be a specialized foot.
Are any of these prosthetics waterproof?
Yes.
Yes, they are.
Yes, and
so
they're
someone can go swimming with.
Absolutely.
Wow.
And there are ones made specifically for that. There are ones that are made to help you in the shower.
Okay.
But absolutely, people will get there are water feet that are designed specifically for that drain water away and aren't heavy.
Wow. And that are stable, right? So you don't slip.
Yeah.
Okay.
Yep.
Wow. What else would you like to tell us about your company and about what you guys do? A little summary of that.
Well, we're a relatively large company. We have a lot of people that have a lot of knowledge. We work with all the newest technology out there. So if it's appropriate for you, we can help you with that. But whatever's the most appropriate, we're there to help you.
Oh, we do have one last question here from someone that's watching. Is there a doctor here locally that uses a plant-based diet to control type 2 diabetes? I'm not sure if you can answer that, but
I mean that's more of a holistic doctor. It's possible that there's somebody down in the valley that can recommend that, but I don't know one that I could say.
As far as the diet goes with having a prosthetic, they're going to have to change the way they eat, right? If they have a different type of structure to them.
They just, at minimum, you have to be aware of what you're eating.
Okay.
And then cautious about it. You know, somebody has a birthday and they have a cake and ice cream, you can't just dive in like you did when you were younger.
Yeah. Can you tell the audience here and tell us how to reach you if they have any more questions?
Absolutely. They can reach us online at hanger.com, but here in the Valley, our phone number is 956-428-1160.
Okay. Thank you so much for being here with us today. I really appreciate your time and
thank you.
Your knowledge.